Hello, my name is Paisley Robinson and I'm going to be demonstrating my subcutaneous injection technique video. I'm going to make sure that I follow my general principles and safety practices along with my 11 rights and my 3 checks. I'm also going to make sure that I have all my equipment gathered along with verifying all the orders. So first I will go ahead and knock on my patient's door. Hello, my name is Paisley. I'm going to be the nurse taking care of you. Can I get your name and date of birth?
Jared Robinson, 7/31/87.
Thank you. I will go ahead and check that against the wristband. Make sure it matches. It does. Do you have any allergies?
No.
Okay. Then from here I would go ahead and perform any necessary assessment that was needed before giving any kind of injection. So with subcutaneous, there are 5 injection sites that you can give. So I'm going to go ahead and demonstrate where you can give those. Can you go ahead and stand up for me? So first you can give it on the upper outer part of the arm in this extra adipose tissue here. Second, you can give it in the abdomen region from the costal margin down to the iliac crest, 2 inches away from the belly button. Then you can also give it in the anterior upper part of the thigh. You go ahead and turn around for me. You can give it in the back area, and then you can also give it in this upper ventral glutea area right here. You can go ahead and have a seat for me. So next I will go ahead and demonstrate on my injection pad how I would give a subcutaneous injection. So we'll go ahead and perform hand hygiene. And then I'm also going to be demonstrating how I would draw up medication from a vial. So then I would go ahead and put my gloves on. And then I'm going to be using a 27 gauge by 1/2 inch. So for subcutaneous, lengthwise, you can use anywhere from 3/8 to 1 inch in length. And you can use a gauge anywhere from a 30 gauge to 25 gauge. So what I'm going to do is go ahead and clean the top of my vial in a circular motion. And then I'm going to allow that to air dry. So then holding my syringe in my dominant hand, I'm going to uncap it. And then what I'm going to do is I'm going to hold on to my vial, and then I'm going to go straight in the center. Then what I'm going to do is I'm going to flip it up and hold it at eye level, the medication, and I'm going to go ahead and draw up what I need, making sure that I do not touch the inside of this plunger. Okay, good. So then I'll remove that, and then what I'm going to do is I'll use the swoop method to recap my clean needle until we're ready for it. So then that's ready. Then what I'm going to go ahead and do is clean my tissue in a circular, firm motion. And then I would allow that to air dry. Make sure we don't blow. And then with subcutaneous, you can go in at a 45-degree to 90-degree angle. So for this demonstration, we're going to go in at a 45-degree angle. So what we're going to do is hold in our dominant hand our syringe, remove the cap. Then we are going to pinch the tissue. And then we are going to go in swiftly and quickly at a 45-degree angle. And then what we're going to do is we're going to release the tissue before we inject the medication, because you don't want to inject medication into compressed tissue. We're going to slowly inject the medication. And then we're going to come out exactly how we went in at a 45-degree angle quickly. Then we will immediately engage that safety and dispose of that in the sharps. We'll go ahead and apply some pressure, just making sure that we're not massaging it. And we're going to make sure that we just kind of do that until the bleeding, if there is any bleeding, stops. And that looks good. Then we would remove our gloves, perform hand hygiene, and then we're going to make sure that we immediately document everything that we did, our injection site. And then we're going to make sure that we come back and evaluate our patient for any kind of adverse effects, see how they're doing, and make sure they have no redness, irritation, or any concerns.